Hi everybody, this is Dr. Bulow with Revive Upper Cervical, and today I'd like to address a concern or a question that we get a lot out in the community. Not usually when people are here in our clinics, but sometimes our doctors are out in the community doing a health screening or a public health discussion or a lecture. And sometimes we'll get this question of, is your services covered by our insurance? You know, a lot of people are paying a lot of money to these private medical insurance groups to receive medical care, and sometimes are paying in hundreds and thousands of dollars for their premiums each month, and they want to know, is upper cervical care, is specific chiropractic care covered in my plan? And it's a long story. It's a tough question to answer on the spot because there's a lot of considerations that go into that discussion. And what I'd like to do is kind of give you a little bit of an in-depth look as to where insurance plays a role in today's marketplace, healthcare marketplace, as well as in a clinic that is an exclusive upper cervical chiropractic clinic. Okay, so let's talk about the healthcare marketplace today. Medical insurance is covering medical care. It's covering emergencies and crises. It's covering the management of diseases and disorders. In fact, if you look up Dorland's Medical Dictionary, the definition of allopathic healthcare, which is essentially the type of medical care that you'd get in the United States, is the treatment of diseases by any means necessary to reverse the onset or the presence of a given symptom. So it's not actually based on how healthy you are or what's right with you. It's based on how sick you are or what's wrong with you. Okay? So if you go to the doctor and you say, this is an analogy I give all the time, so I'll give it to you here. If you say, I have a headache, let's say this block of wood right here is the symptom that you have. So you go to the doctor, you say, I have a headache. And the doctor says, aha, headache, easy to treat. We have a lot of medications for that. We give you a medication and it covers up or removes the headache out of your body, right? It managed that disease or disorder. So then you go to your insurance, your medical insurance, and you say, I had a headache. The doctor prescribed me this headache medication and it removed that from my body. And they say, yes, that medication has been proven to manage headaches. It's been proven through trial and error and lots of research, and that's why it costs lots of money. It's been proven to be an effective means of diminishing the headache. Now, and so they'll cover that. The insurance will cover that. But let's say, for some reason, that medication doesn't work. Or it does work, but it really causes very bad, harmful reactions to your body. So while you're trying to manage this headache with this medication, you go to another doctor. And the other doctor says, well, instead of managing what's wrong with you, let's just try and help your body perform better. I notice here that you don't drink very much water. I'm going to recommend that you go home and you drink more water. And so you go home, you buy a case of water, and every day you're drinking 6 to 8 bottles of water a day, 12 bottles of water a day. And lo and behold, your headache goes away because little did you know you were just dehydrated and your body wasn't performing at its best. So now you go back to the insurance company and you say, insurance company, I had this headache, but my doctor told me to drink more water. And I drank more water, and all of a sudden my headache went away. My body has actually healed itself because it's just performing better. And here's the kicker. You go to the insurance company with your receipt to the bottle of water and you say, here you are. This is the case of water I bought. I would like to get reimbursed for my purchase of this case of water. Your insurance company is going to look at you and say, we don't cover the expense of water. Even if that helped your body heal, that has not been proven to be a specific treatment for the symptoms of a headache. See what I'm saying? The insurance company will say, that's considered wellness care, health enhancement, lifestyle care, and is not medically necessary because it's not a specific treatment for a specific condition. You see the difference? One model of caring for yourself is treating what's wrong with you, regardless of how healthy you are. A Tylenol is going to treat a headache whether or not you're a relatively healthy kid or a stage 4 cancer patient, the Tylenol is targeting and zeroing in on removing pain out of your body. It doesn't make you any healthier, it just manages what's wrong with you, right? So medical care is based on treating what's wrong with you, disregarding how otherwise healthy you are, for the most part. True health care is saying, we're going to drink more water, we're going to exercise, we're going to keep our spinal alignment intact and our nervous system clear of any irritation. That's what chiropractors do. Why? Because we know that that is the best thing that we can do for the body to help it perform better, regardless of what's wrong with you. See the difference? So medical care and allopathic philosophy treats what's wrong with you in spite of how healthy you are. Real health care enhances what's right with you in spite of what's wrong with you. See the difference? So they both are valid, and we need them both in a society. I wouldn't want to live in a society that didn't offer the very best in medical emergency crisis care. But when it comes to your health, once the crisis has been managed, to get your body functioning as best it possibly can, we have to look outside of the medical system and look at, okay, how can I help my body perform better? Not just manage what's wrong with me, but actually perform better. And that is the fundamental reason why a lot of specific chiropractic clinics are not in network, because the philosophy is just different. We're looking and saying, how can we make this person perform better? And we don't want the insurance company coming in saying, well, you can only do this and you can only do that, and only with this symptom and only with that symptom, and only these approved treatment options for this symptom. It has nothing to do with our focus in how do we make you the very best version of you that we can. And it muddles the mentality and gets in the way. So it's not that we can't be in network, it's that we choose not to be, because we know that to provide you with the very best of care, we have to focus on the things, and only the things that we know are going to make you a better person tomorrow than you are today. And that mentality and those services, insurance has deemed not medically necessary. So that's the truth. That's the underlying philosophy, the underlying reason. We could talk about the fact that we don't do ancillary procedures that are just in disease treatment and all these other things, but at the end of the day, everything we do in a specific chiropractic clinic, in an upper cervical clinic, is designed for the sole purpose of making your body function better, regardless of what disease process you have. Because we fundamentally know that the body inherently can handle most disease processes on its own when it's running at that fullest potential. So I hope that gives you a little bit of an insight as to why you'll find that most specific and exclusively chiropractic clinics tend to be out of network. And if you have any questions on this, please feel free to ask them. We're always here, and I appreciate you taking the time today to watch this video. Take care. Bye now.